Radio 94.3, an iHeartRadio station.
This week only, get 3 original HP ink cartridges and save. Good things always come in threes. 3-day weekends, 3-piece suits, 3D movies. And during this very special week, buy 3 original HP ink cartridges and save 40% on the third. The quality and reliability of original HP ink. On sale this week at Staples, Office Depot, Office Max, Best Buy, and HPDirect.com. Offer expires 8/23/14 while supplies last. Restrictions apply. Visit hp.com/go/ink for details.
Know-how! Too many burgers topped with chicken fried steak dipped in nacho cheese would do a number to your arteries. Grime and sludge do the same to your engine, but without that delicious flavor. Luckily, Napa has Seafoam motor treatment for just $7. So with $7, grab some Seafoam at Napa and get your engine's arteries clean. And eat a vegetable every once in a while. Conquer the job with Napa Know-How. At participating Napa Auto Parts stores while supplies last. Offer expires 8/31/14.
WZZR, Riviera Beach. Real Radio 94.3 is available anywhere you go on the iHeartRadio app. Download it now. Real Radio 94.3, an iHeartRadio station. From the Plumbers911.com Weather Center.
Here's the very latest from the CBS 12 Storm Track Weather Center. Drier and sunny weather working into the picture. We're getting up to about 92 degrees today. It'll feel like 100, though, to 105. Overnight tonight, partly cloudy skies as we fall back into the mid to upper 70s. Same deal on your Monday. Hot, highs in the lower 90s, and mostly sunny skies. From the CBS 12 Storm Track Center, I'm meteorologist Craig Gold for Real Radio.
94.3 Real Radio.
The following views are those of the host and not those of Clear Channel Broadcasting licenses.
Have you gone to the doctor recently because of pain throughout your body for which there seems to be no relief? Introducing Dr. Anthony Pannozzo. The Dr. Pannozzo Sports and Medicine Hour will bring you a new technique to resolve painful issues throughout the body. Dr. Pannozzo has worked with over 65,000 patients over 40 years and has developed a revolutionary approach to pain treatment. His treatment allows fast and effective treatment of pain without narcotics, surgery, and physical therapy. There is no manipulation or alternative approaches. Weight bearing and the return of normal range of motion without pain is the best kept secret this man has to deliver. So, get ready to call in and ask all of your painful questions and get the answers you've been looking for. Now, here's today's edition of Dr. Pannozzo's Sports and Medicine Hour.
Good morning, everyone, and welcome to another Sunday with Dr. Anthony Pannozzo, the man that guarantees to cure the pain you came in with, right, Doc?
The only one you're complaining about the most. That's the one we
That's
work
what we
on.
play.
Yeah.
I want to welcome our director, producer, and the man that makes this possible from AMP2.TV, Mr. Frederick Santori.
How are you, gentlemen?
And who also has a show that's based on Dr. Pannozzo called Pannozzo.TV.
That's right, Pannozzo.TV. Come and watch us. And we got some good surprises today.
Okay, now, first of all, we always talk about autism, and I want to ask you, some of the things that came from Autism Speaks is the word diagnosis.
Yes.
How do we diagnose a person that has that disease?
Well, if you read the whole thing
Yeah.
that I copied from the internet, I
Right.
just copied and I showed it to you.
Uh-huh.
There is nothing in it to make a diagnosis.
Exactly right.
It's not like the normal diagnosis that physicians make, which is you have to touch it, you have to see it, you have to palpate it, you have to know it's there. It's a structural thing. You can't treat something that's not in the body, you know.
Right.
All right, there is nothing in this article that tells you how to diagnose autism.
That's exactly
and the reason is that it doesn't exist. That's the
amazing.
reason.
It's just a definition, Doc?
The way I look at it.
Just a definition. In
It's-
other words, if I give you a
it's-
definition?
It is an opinion
Opinion. Yes.
of somebody,
Right.
not based on fact.
Correct.
There is no change in their thinking. There is no change in their physical stuff except for the neck. And we talked about this before. I have an explanation for this, and that's a birth injury. And 2 years later, when the child is weight bearing, he's starting to walk, in 1-year-old. It stiffens up just like in an adult. So now you have a bad neck. That's why the people can't have eye contact. It's a big thing. Eye contact is a big thing with this.
I know.
Well, how are you going to move your head if you can't move it? I mean, you know, it's a painful thing, just like an adult. And that's how we diagnose things. A lack of range of motion. Then you have to figure out why it is and the location of it. Then you could treat it. So most of these kids are being treated, can be treated, no problem at all.
So if somebody comes in with a child that, let's say someone like about 4 or 5 years old, they come in with you and want to talk to you about this thing, you could find out and most likely treat them for this.
It's very easy to do a neck exam, but people who are in charge of this program don't know how to do that.
Wow.
They don't.
No,
Neurologists don't examine necks. The orthopedists don't examine necks. I mean, who does? Nobody. And this is why you have a disconnect there. Now, people are going to say this Pannozzo's kind of a nutcase because look at all these places that do this, like Joe DiMaggio Center and this and that and the other of all these universities. But remember, what results are they having, and who does actually the treatment?
Nobody that I know of.
The therapists. And what do the therapists know about this?
Exactly.
Nothing.
Right.
All
Well,
right.
they're giving a solution or trying to give a solution to something that isn't there. They're trying to give an explanation.
Well, they ought to stop doing it and get back to normal medicine, which is evidence. You've got to have evidence when you treat something. How are you going to know if it's improved when you don't know what you're treating? I mean, the whole thing is bizarre.
And Doc, so
Yes.
that people don't attack me. People attacked me the last time we talked about this.
Yeah,
right?
I've been attacked too, but you know what? I'll tell you something,
They
Freddie.
attack you on what?
They attack me because a lot of people are very sensitive
About
to
what?
their children having autism.
Yeah.
And what it is that what you're trying to explain here is that it's just an opinion. And everybody's entitled to have an opinion. And doctors, they fill the blanks with opinions. It doesn't mean that they're right, wrong, or indifferent. It's just their opinion.
But you understand, the thing took off when there was federal and state money available.
I understand.
And that's based on what? Nothing.
Correct.
It's not based on medical evidence. Show me one thing that is evidence, and I'll say it on the air that
I'll bring in the doctor if he has the evidence.
I see the evidence, but they don't have the evidence.
They don't. But what I like about what you said makes a lot of sense because that pulling out of the canal, what damage does that cause? What, because the infants? Nobody knows.
You have no idea what
That's
it can
very
do.
I agree. So I'm saying this
And if it
might
gets-
be a good...
If it gets bad enough, you get a cervical sixth nerve disruption. It'll just break apart, so you have a paralyzed arm. These are documented cases. The way you deliver a baby is you get in there with your finger and get the shoulder down, and the shoulder will move, no damage to it. And then the baby will just squirt out at you. I mean, I've delivered 40 of them, so I can tell you as not an expert, but as a semi-expert.
Well, you're a physician, a medical doctor who's probably had to do all that stuff when you were in med school and when you were interning.
That's the way I was taught.
Right. The right way.
Don't stretch that neck, no matter what.
Now, when my son was born, my first, I was right there. And they were going to do a C-section. I was amazed on how they turned that room into a C operation room. It's instant. I mean, it's unbelievable.
Yeah.
And there was an Oriental doctor that got Freddie, my first, by the head with the forceps.
Yeah.
And he says, I got him. Now, they were going to give me a shot at it while they were converting. But he yanked Freddie's head forward.
Right. That's right.
Oh, that's what Freddie has. No, I'm only
He
kidding.
still has a scar on top of his head from that force.
But Frank Sinatra was a famous one. That happened to him.
So, okay, now in those cases, God help that Freddie has autism, but in those cases, there's still damage that is created when you're pulling on that spinal cord, yeah?
The amount of damage could be small or large, and smaller ones you can handle.
Right.
But the larger ones become evident. And now, just recently, a patient of mine said her grandson had autism, 10 years old. And I said, is he still having trouble turning his neck? Yes.
Amazing.
I said, why don't you bring him in? I'll examine him. I mean, I don't have to charge him at all. I mean, just want to do it just to see what he's got today, because I did research on this.
Right.
33 kids with diagnosis of autism, which was not true.
Right.
There was only about 20 of them that would actually fit. And fit what? I mean, no evidence there, just a bad neck. They all had bad necks. And but I'm not in the business of pediatrics or treating autism cases, so we didn't encourage that. But I have all the records yet of these 33 kids with their names, and there was no way to tell anybody about the diagnosis because nobody's inquiring I mean, where were the doctors saying you examined him? What did you find? Nobody asked. No, nobody. Everybody's got their own little thing that they do, and it doesn't matter if you get results or not.
That's what it looks like.
See, my thing has always been this. Maybe it's because I'm older and I'm cynical, but to me, I can't understand why anyone who has a problem with pain or with a child that has autism doesn't at least give Dr. Pannozzo a call to just come visit.
Well, that's an interesting question.
Because he'll come and talk to you, and he'll tell you if he can do something.
Well, that's an interesting question. Why don't you give out the number? Because I want to hear stories of anybody there with the pain. And then we have a guest, because our board up went to see Dr. Pannozzo, and I want to find out. And I didn't hear anything about this. I didn't even know he went to see you, Doc. So I'm dying to hear what happened. Good, bad, or indifferent.
Oh, well, let's do it. Jimmy, you want to talk about what's going on? How do we get to Jimmy?
Jimmy, you there?
I'm here.
Okay. Tell us what happened when,
wait a minute. Introduce Jimmy.
Jimmy is aboard up over at Clear Channel. Jimmy has been the guy that's been able to help us with our signal and bring in calls. And he, like everybody else, listened to what Dr. Pannozzo could do for migraines, and then he's heard what Freddie keeps talking about. Now, Jimmy, tell me what happened.
Well, I was a little skeptical at first, and like everybody else, I called him up. Freddie, actually, I got to give him a lot of credit. He's the best one that I've heard from.
That's nice.
Don't let it go to your head. Listen, anyway, I went over to see him. I've had these troubles with my neck and everything since '95 when I rolled a truck. But I went and saw him on Friday. It was worth the hour-and-a-half drive down there. I bet I waited, 45 minutes in his office. It was all cool. Went in there. He did what he said he was going to do, and I've walked out of there, and I haven't had anything since.
Wow.
So we're going to see how this goes, and I'll keep you informed.
That's terrific. Well, I tell you that I'd be surprised if he had anything come back, not in the same area anyway.
What did he have, a migraine?
Well, I had the muscles in the neck, and it was giving me migraines. It was giving me headaches.
Headache is not a migraine. He had no true migraine, like as we describe it.
Right.
But he had a bad neck. He had two joints, facets bothering him, and we took care of those. So he walked out. Range of motion was normal, and he didn't have the pain.
Now, Jimmy, you haven't been paid to do this, right? Dr. Pannozzo hasn't paid you anything to come on and talk about your event.
No, heck no.
Okay, no, I just want the public to know that.
He offered to help me out. I went down there, and he's done what he said. I mean, I don't see where there's going to be any bad issues of this thing. I think it's going to turn out to be a good thing. And I did talk to some of the people in the office in there that have been there for other reasons, and they're not even coming back for the same reasons.
That's true. You come back for different reasons.
He was there, and he does what he says. He answers his phone. He does what he, hey, listen, I got to give this guy a lot of credit.
Thank you so much. We appreciate that, and I think Dr. Pannozzo appreciates that because he's there to help.
Now, did you like the machine that shows your inners?
Oh, that thing was, well, I saw it after the fact. I was there to get fixed. Whatever the machine is, listen, that's what it is.
Right.
If it does the trick, that's what it is. And if him and his son are the ones doing this, and they're doing a great job at it. You said 65,000 or somewhere.
78 now.
70. Oh, I apologize.
That's okay.
Listen, I do want to say the gal that he fixed a while back. What was her name?
Leah?
No. The gal that came from the other country over there.
Oh, yeah.
From England.
The England.
With
scoliosis.
A letter. She actually, I don't know if he showed you the letter, but listen, she sent him a letter. She's grown 1.5 inches since then.
There you go.
She's grown, and I saw that letter.
There you go.
And she's planning on coming back to see him.
That's unbelievable.
Oh. They'll be coming back this winter, and they have a place to stay with the son in Delray, and yeah, that's true. 1.5 inches she grew, and the pain she's having now is in a different place. It's not the same pain.
Which happens.
Yeah, well, it's got to happen because you use different structures as you improve, and 1.5 inches is fantastic. As a matter of fact, Freddie.
I've grown over 1.5 inches.
I got to tell you, yeah, Freddie grew 1.5 inches. But Fred did not recognize this woman.
No, I didn't.
He come in the interview and walked right past her.
I did, and I apologize.
She was taller, skinnier, and had her. She was made up, her hair done, and she felt good. That's a sign.
Fantastic.
That's the signs I look for in especially females.
You know,
men don't wear makeup, but when they feel better, they
She
do
looked
dress
like
up.
$1,000,000.
Yeah,
Yeah, they
she
dress
looked
up, they put makeup on because they feel better. It's you know, no more pain. I mean, from going from bending over to almost straight, that is phenomenal for someone that was told they can't do anything for her.
And the funny thing is, Jimmy, I have this on film.
Yeah.
I saw her straighten up. I have the evidence
Right.
that we're going to post.
And, well,
which
and
is
I saw the letter. I mean, the letter doesn't lie.
Nope.
It can't. It was in her own handwriting. It was amazing. Absolutely amazing. And I need to see that video too. But when you post it, you'll have to let me know. But that letter said it all. It was like a doctor, wasn't it 2.5 pages or something, or a page and a half or something?
Yeah, it was 2 pages long and signed by Mrs. I'm not going to say her name.
No, don't say her name. Correct.
Yeah. But it's amazing. When you see things like that, you can't believe it, and then you believe it when you actually see it, and it's amazing. And with what he's done with my neck so far, I got to say that I think that I'm not going back there for the same problem. I don't think I'll ever
no one. You know, Jim, what's very funny about it is nobody does.
And they haven't.
No.
Everybody that had been in there was there for something different, and they've been to him a few times, but for other things.
Oh yeah.
I believe the one gentleman was in there for a tennis game, and he said, "I never come back for the same place."
No.
And he was 60 or 72 or 73 years old, Doc. I can't remember, but he was somewhere in that age coming to see you just so he could still play tennis.
Yep.
And we always tell people, if you come in and your right shoulder is bothering you, that's where your pain is. Don't say he didn't fix your left shoulder because you came in with a pain in your right shoulder.
Absolutely. He fixed everything I told him was wrong with
This
me.
is what was wrong with me. I fixed it. Oh, Doc, you know, you didn't tell me your left shoulder was bothering you.
Yeah,
I
that's
really
true.
appreciate that. That is so, you know, what's nice about it is that people that were skeptical like you, and probably a lot of people out there, but I've witnessed, not you, 3 other people, which Freddie was there to film another gentleman that was there, that spent $30,000 on everything you could possibly think of. Talk to me about that when he walked in with you, please.
Yeah, he spent a lot of money. It wasn't his money; it was insurance
Well,
money.
it's still $30,000, right?
We all pay for that.
Freddie and I
Believe
pay
me,
for
we're
that,
all
that's
paying
right.
for that. And mistreatment, they did everything but diagnose what was wrong with him.
Mm-hmm.
And that's how you accumulate $30,000 worth of testing and treatment. So if you don't know what you're doing. So we took care of it the same day he came in.
Right.
And, you know, he was actually the state worker. Now, I remember who you're talking about now.
The geologist.
Yeah, he was
Don't
a
give his name out.
a state worker.
A state worker, and a very educated, straightforward guy. I mean, he just sat there and just let it out, just like that. My pain is leaving, and it's gone. I mean, you know, that's, you know, people can't believe half of this stuff.
It's.
But it's all true. It's not half true. It's all true.
Oh, we got who do we have on the? We have Brad. We have Brad on the line. Let me get a hold of Brad and see what Brad wants.
Let's see what Brad wants.
We always want to.
What a wonderful host you have over here.
Hi, Brad.
Yeah, how's it going?
How's it going? Good.
I have a question. What's the process that I've been diagnosed with a mild case of scoliosis. I'm 30 years old. I just turned 30, and I was wondering what's the process that you guys do to fix the actual problems that you got, the pain or whatever. You said there's a machine or something.
That's easy.
But what is the actual thing that actually makes all of it work?
No, it's not the machine. The machine is just for anatomical accuracy. You have to know what's doing it. And scoliosis is an injury that causes scar tissue between the vertebrae. And the scar tissue will tighten down inexorably. That's what scars do. Now, this is not a surgical scar. This is a scar tissue from injury, inflammation, and then scarring down. And so if it scars down in the wrong place, then you have a curvature. And unless you know how to deal with that and where it is, you can't really treat scoliosis. That's why I say the therapy, chiropractic, orthopedic surgery, none of those people have the answer to this. I do. And we could show it to you right on the screen. Mm-hmm. And so if it's scar tissue and it's old, like in your case, you're 30 years old, you're not going to get rid of this without getting the steroid that we use right on it. And that's what we do. It's a shot, It goes right on the scar tissue, and you watch it turn right in front of your eyes on the screen. It's an X-ray. So we do an X-ray, and then 5 minutes later, after the injection, we do another one, and you can see the bone actually shift right in front of your eyes.
Let me give you Dr. Pannozzo's office number, 561-381-5800.
Yeah, call that number, and we'll give you an appointment. But this is one-of-a-kind approach. You're not going to get this anywhere in the world, and I really do mean this. I did the research on this. I've been treating this stuff for 45 years. It's so long I can't even calculate it
I have my
anymore.
notes here, Doc. Don't worry about
I
it.
don't have enough fingers to add up all the years I've been working. But no, all kidding aside, it is not a serious problem to take care of. You just have to understand the system, come in and get it done, take an evaluation, an examination. It'll be worth every dime you got to spend on it. And if you don't have it, I'll do it for free. But at least you ought to know what you have and what can be done for it. And if you have decent insurance, it'll cover all that.
Yeah, that's another question I was asking, if you guys are covered underneath insurance.
Which?
That's awesome. Yeah, I'm definitely going to give you guys a call then.
Which insurance is it?
Humana?
Humana PPO only. The HMO, they
don't
won't
cover it.
They won't pay us.
Yeah, it's PPO. Yeah, definitely.
Yeah, PPO is fine. And you know, the amazing thing here is that when you come in, you can actually, from the pictures that you showed me on the lady from England, her spine was twisted tremendously.
Oh yeah, turned and curved.
And then her growth is, Doc, if I'm wrong, you correct me, her growth is because the spine is turning into place.
That's right, yeah. It's straightening out, right.
And I grew. And I love it because I walk around and I can see everybody that's lower than me.
Well, I hope you don't keep growing.
I love it.
He loves it to be tall.
Then Linda's going to have to start wearing high heel shoes now. No more flats.
Well, it's funny because my youngest son was taller than me. Now I'm taller than him. He says, "What are you doing?" I said, "Dr. Pannozzo says, you got to be kidding me." And he says, the bottom line here is just like Jim went to see you. I've been telling people for over a year, if you have that pain, let the man look at you. The worst thing that can happen is that he can't help you. I haven't run into that yet.
Yeah, that's all. I mean, what is it, to me, maybe I'm an idiot, but for me, if I had pain, I would do everything I could to not have to go in for surgery, because I know someone who's gone for surgery, and guess what? They are in such pain. In fact, I knew this person 2 years ago and still have pain after going for surgery.
Well, here's the reason. They have a scar tissue in the beginning.
Right.
That's what the pain is.
Oh, wait, 1 second. Brad, were we able to answer all your questions?
Yeah, I appreciate it so much. I'm going to definitely give Dr. Pannozzo a call.
Thank you so much.
Brad, when you get down there, we want to take film of that because we love the scoliosis part.
Thank you so much, Brad. Have a great Sunday.
All right, have a good one.
I'm sorry, Doc. I didn't mean to interrupt. Go ahead.
So you have scar tissue. Yeah, this is the way you have to look at it as a layperson. Right? I have a piece of scar tissue causing me a pain.
Right.
And these tissues are only an inch long or half. I mean, they're not big, but they ruin your life. I mean, it's devastating what these small tissues can do to you. Anyway, if you have a scar tissue to begin with, causing the pain, and you get a surgery, you have another scar tissue. Now, what do you expect to happen? I mean, you don't expect to get well, do you? No, I wouldn't.
Amazing.
Now, I got a question.
Yeah.
If you have an operation, do they take the scar tissue out when they do the operation?
They don't even know where it is. They don't approach it like that. They
Okay.
approach it as a piece of bone that they have to remove. I mean, the whole thing is a disconnect. I mean, I'm giving you avant-garde. This is the future. This works. And if you say, do I have any failures? No, we don't have any failures. Everybody gets something, some improvement. But when you take a surgery, can you say that? No, you can't. You cannot.
What's the first thing a surgeon says? We can't guarantee
There you go.
that you'll be able
work.
to be, right.
They make you sign that.
Yeah. Oh, yes.
So why would I go in there?
That's what I'm trying to figure out. To me,
it's a desperation motive. It's because they've had it so long.
people believe
And
it.
they've been here and they've been there, and the surgeon offers you something, so you go back there and you have it done. And I'm saying, don't take the bait. Don't go to the chiropractor. Don't go to the therapy. Just come and see me first.
I mean, what do you got to lose?
Yeah, the chiropractor, the surgeon is always going to be there.
Yeah, and you can always get a surgery. That's what I tell people. You can always get operated. Once you're done, though, you can't go back. You have another problem.
They're going to come in with another problem. I was just thinking about that.
Well, this is what happens to the golfers.
Right.
You know, there's certain situations that should never be operated. One is the ankle and foot.
We found that out.
You need the mobility there, so you should never have that operated. The hand and wrist, never operate the hand or wrist. You need the mobility. And shoulder is another one. So, and the neck also. Well, any surgery, I guess.
Right.
If they do a fusion, put a plate
You're done.
On your neck. Well, I have a postman now. Good thing he has good insurance. He's always having some pain. We're always treating this area.
Oh, those post guys are always in pain.
Because you can't take that plate out.
Right.
And I you know, I don't know. It's a shame.
Greatest golfer in the world, Tiger Woods, went in for the surgery.
Well, he's had multiple surgeries, and every one of them has contributed to his downfall. And I predicted this 4 years ago.
Yes, you did.
And I had a discussion.
Everybody thought you were crazy back then.
With my brother Jim, and I said, Tiger Wood is not going to do well because he's got a hip problem. They're operating his knee. And he said, oh, you don't know Tiger Woods. Yeah, you're just, you know, talking.
He just opted out of the Ryder Cup. I think his career's over.
His career is over.
It's not over.
No, you don't think so? Okay.
Absolutely not.
He's not. He won't come see you.
Well, if he comes, we would throw all his instructors away. He'd say, don't ever talk to these people again. They don't know what they're talking about. We'll take care of this pain. We'll give you a swing that you had when you were 12 years old. Then you go right back out there, and you don't need any instruction. You know how to play golf.
There you have it. That's why the world is upside down, Les.
Right, so anybody that knows Tiger Woods, he doesn't live that far away from where Dr. Pannozzo is, and I'm serious. 561-381-5800. Forget taking the knife to your body.
Well, he already took the knife.
Well, I mean,
Golfer.
they're going to make him go it again. I mean, you know.
See, if you understand the golf swing, which the PGA instructors do not, you know, it's an anatomical problem. How do you use your anatomy? It's called a physiology. How do you get that club head around? You don't do it by looking at somebody and saying, oh, we're going to change your swing. No, you have to look at it, what's causing the pain there, what's causing limitation of motion, which is actually causing the problem. It's not the instructor. You could go over it with the instructor later, but it's a medical problem first. You take care of the swing at the tee. That should be normal, full range. I mean full, no pain. And if it isn't, we can take care of that pain, and then you'll see on film, I mean yourself, before and after treatment, you'll see that. And then you're going to get all the yardage back.
And he has multiple areas.
Oh, yeah.
So this is why I think you just hit it on the head. The whole world's upside down. Here comes Dr. Pannozzo and says, listen, let me fix you up. You got 1, 2, 3, 4, 5 areas. Okay, so let's start with 1 and work to 5, right?
Right.
Nobody does that.
No, because nobody, you know, here's a key that a lot of people don't understand. Nobody is able to or don't want to do. He actually diagnoses where that pain, I mean, I've seen it. I mean, you know, I'm doing a show to try to help people, and so is he. He's the only one that could find, he is cause and effect. What caused that pain, and he gets rid of it. I mean, we saw it with Leah, and, you know, came in with, was going to get a boot at the podiatrist because of pain. I mean, she just walked up and down, and he diagnosed her situation just by her walk and fixed it. I mean, my God.
Well, there's a guy in Pennsylvania that's Linda's family, and I told him to come see you. He opted to go for the boot. Now he's in constant pain.
Yeah, well, well, the ankle should never be operated or booted because it causes scar tissue. You need mobility. People, remember, you need mobility in your hand and foot. These bones have to move.
Folks, I'm going to have to take a break now. I mean, when Dr. Pannozzo gets started, it's so exciting and interesting that I forget to look at the clock. That's my fault. We'll be back in 2. Thank you so much for listening.
Have you ever had a business idea that you thought would be a great solution to tough challenges in today's world but have no idea of how to get started? You don't want to waste investment money on ideas that just don't work. Introducing Health and Wealth Seminars, a sophisticated advertising agency with over 40 years in the ad business. What makes Health and Wealth different from other agencies is that they fit your product into the public's need. They help put together the strategy of your business before you commit thousands of dollars just to find out that those ideas don't work. Health and Wealth Seminars carries advertising contracts, radio and television contracts, and even a production service contract that'll cover all of your business needs. Call today, 954-303-9563, and let Health and Wealth Seminars carry your business to the next level. The number is 954-303-9563. And remember that what happens when you don't advertise is nothing. 954-303-9563 is the number you need to get your business started in the right direction. You're listening to Dr. Pannozzo's Sports and Medicine Hour with Dr. Anthony Pannozzo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pannozzo now at 1-877-927-6969 to get your pain issues resolved. And now, more of Dr. Pannozzo's Sports and Medicine Hour.
Okay, so where do we leave off? First, let me give out some numbers, folks, because if you want to get on the hotline, it's 877-927-6969. That's 877-927-6969. Or if you'd rather speak to Dr. Pannozzo, you will be surprised, like Jimmy was. He does answer his phone, 561-381-5800. Now, go back to what you were saying, Doc, before we left about diagnosing and how important it is to diagnose the actual symptom of what someone's coming in with.
Yeah, you have to understand how the body was designed.
Okay. And you're a musculoskeletal expert.
I'm a musculoskeletal expert. The body was designed a certain way. And once you understand that, then you can figure out how it went bad. And most of the pain that you have is a physics problem. It's based on weight bearing of the body. For instance, if you have diagnosed L4-5 something, you know how much weight is on this little bone? It's only about 2 inches around.
Really?
Maybe 3.
Wow.
And that's it. So if you weigh 160 pounds, you got 160 pounds per square inch on this little bone, which is in the lower back. There's nothing else there. Look at it. There's muscles surrounding it, and that's all. That's a weakness of the design. But once you understand that, see, you can get around it. Mm-hmm. But it's a weight-bearing issue. This is how I look at it. And each segment of the design has a function. So once you understand that, then you can approach it on that matter and say, why is the function not there? So it's cause and effect relationship. See, that's how you look at it. So I'm a physics student, and that's how I look at this. We have designed the special films that we do, which goes along with this. But first we have to diagnose it, then we do the film. We don't do it in reverse like most people do. When you have somebody reading an MRI at you and they're diagnosing from that, walk away, because that is not going to be true. You have to be examined. That's how you find out what's wrong with you. And a decent history. You can't go by an X-ray.
So an MRI doesn't mean anything.
It means something. Yeah, it means that you don't have a tumor in there. It means you don't have a cancer. But when they diagnose a bulge of this, bulge of that, you say, well, why is it bulging? They don't answer that.
That's right.
Okay, that's what
cause and effect.
That's what you have to know. Why is it bulging? Don't read a bulge without telling me why it's bulged. Right. I mean, if the MRI is that good, they ought to read it that way. But
well, the MRI isn't going to help you anyway.
That doesn't help you. It's
interpretation.
It's interpretation, and you have to be able to then do a treatment. So what good is it if you don't do a treatment with it? So, I mean, it's not going to get you anywhere.
Source of the pain.
You got to be able to know where the source of the pain is. So we worked all this out over a period of years, and that's why we had, what did we say, 78,000?
78,000, Doc.
Now, we have a lot of offices, you know. Phoenix, my son was supposed to call up.
Yeah, what happened to Paul?
My son, Paul, he does the same work, and we discuss cases almost every night. And
it's true.
I think he calls up to make sure I'm alive. But
well, he's seen you all over the place.
I mean, he sees you all over the world. I mean, we get calls from everywhere.
So, but we discuss things and every night, and so we talk about these cases. And his standard is the same as mine. So, if anybody out west, just go over there, and you'll get treated right.
We're not going to plug him unless he calls up.
Doc, I got a question for you. Is it TMJ? Is that what you guys talked about that time? TMJ?
TMJ.
Okay, have you seen the latest commercial for TMJ? How to repair it?
No.
You put something in your ear. Looks like an earplug.
Are you serious?
Linda, remember we saw it?
Yes, I do.
And the funny thing is, they're selling millions of these things. You put one in your ear, and it takes away TMJ. Have you ever? $29.99. I have no idea, Doc. He's looking at me like I'm crazy.
I think people are crazy if they. Well, you ever wonder why things are priced the way they are?
Oh, it's $29.95.
Just $19.99.
$49.95, $29.95 because
anything below $20 you can sell.
Yes.
I mean, people send in their $20. They don't think it's anything.
Because
but it's perpetuating something that's just not true.
Well, the dentist charged $2,400 for the mouth guard. Now, I don't know about anyone out there.
Oh,
I don't
no,
know if I
never
could
do that.
sleep with a mouth guard in my mouth.
No,
Number
it's
one.
the same as a boot. You never
Yeah.
want to inhibit motion. You
Right.
never want to operate the TMJ. It has to do a lot of things for you. It has to masticate food. It's got to move. It's got to open.
That's why they put it in your ears.
That's why.
Well, look, we had Doc.
Oh, there's another thing out there, which is if you have back pain and leg pain,
Yep.
sciatica, there's a little brace with a pin on the back, and you put it behind your knee.
That's to take the pain away from the sciatica.
Yeah, it's supposed to be a trigger point. People, there are no trigger points. There are
Scary.
none. Believe me, there are no trigger points.
But the most important thing is that you get rid of it. It's
Well,
not coming back again.
You got to know where the source
Right.
is, and then you can arrange treatment for it. And the back of the leg pain, we get rid of that in one day. It does not come back.
You know, it's funny, Freddie. It's like a guy comes in to the surgeon and his arm is cut, and he said, "Let me just wrap it up." He didn't get rid of the guy. The problem. That's
They
what-
put a Band-Aid on it.
No, he put a band. Well, I think that's what a lot of doctors are doing now.
877-927-6969. Call in and let us know the crazy contraptions they have out there.
Well, there's a new one that what's his name is
Also,
endorsing.
if you're doing good, call up because people want to know.
Yeah.
They listen to me and they say, "Well, the guy's just trying to make a living." No, I'm not. I've already made my living.
I mean, let me tell you.
Well, what about family members that say, listen, don't go see this guy. He's nuts. I have a good doctor over here. Let's go see him.
Yeah.
And a year later, you're in the same position that you started, and they forgot all about you.
Yeah.
That's the way it is. My family thought I was nuts when I stood up and said, ladies and gentlemen, I can play golf again. Couldn't play, Doc. I could not play. I was in so much pain.
I watch you play golf. You're really not that good.
No. Well, yeah, but that was before. That was
Now
after
you
the
gotta-
pain.
now you gotta
I couldn't even get out there.
Now you got to learn the art of golf.
Now I got to know how to play. But I couldn't pick up the club.
I know.
And then Linda, bless her heart, she's buying me all these clubs from all over the world. We got clubs from everywhere. I couldn't use them.
No.
I couldn't play.
You know what? My instructor said to me something many, many years ago before I met Dr. Pannozzo. He said, here's how you play golf. You have to make sure that your body is good enough. And that's even before I met you. This guy was like 80 years old. He took a 7-iron, and he hit the ball further than I could hit a driver. And the first thing he said is, it's not the bow, it's not the archer. No, I'm sorry. He said, it's not the bow and arrow, it's the archer. That means all the clubs you buy are not going to do you any good unless the musculoskeletal problem that you have to begin with isn't fixed.
The engineering of it.
That's exactly right.
The physics problem, the range of motion, the weight bearing.
87-year-old guy hit the ball 4 feet further than
Well,
the
Bob,
last.
with a 7.
Bob Tosky still hits it almost to 300 yards.
Yeah.
Amazing.
I'm-
And people still are walking around in pain and they're listening to the wrong advice.
I always tell people, look, you know, all you have to do is go call the doctor up, and he'll tell you if he can help you. If he can't help you, he's going to say, I can't help you.
The people who have trouble with golf, hitting the golf club, instead of going to the PGA instructor first, get evaluated medically first.
Mhm.
We'll show you what's wrong with it. It's easily to fix. Insurance covers it usually. And then you can go to the instructor. And then if you have trouble playing how to play golf, which I have trouble, how do you read the lie? I mean, how about the wetness of it? How hard you hit it? But not at the drive. The drive is a medical problem only. And the PGA instructors ought to understand that. Why PGA National doesn't require that for their instructors to be certified? They should.
So let me ask you a question. When someone comes
It's
into
obvious, isn't it? Once
I got a theory about that,
Isn't
Doc.
that obvious? Once
Yeah, no,
pointed out?
I agree with you. I mean, to me, for an instructor to change a swing, now they've changed Tiger Woods' swing. I don't know if anyone's seen it.
Oh, many times,
Yeah.
many times.
And
You know, Haney had an article on Yahoo. I read Yahoo Sports.
Right.
He had an article on there.
Haney,
$3,000 an hour he charges.
That's exactly right.
Keep it, man. You don't know what you're talking about, Haney.
Well, I got a theory. I think that the golf pros, they purposely change how you swing because they don't know anything about what you're talking about.
Of course not.
They have no clue.
They're
They
not
have
trained.
no clue. So unfortunately, you have the guy in the dark leading everybody else in the dark.
Blind leading the blind. Exactly.
Right.
So garbage in, garbage out.
So
Yeah.
once you get lucky, like Haney did, and he takes care of somebody's swing,
Right.
they were probably going to get well anyway. But anyway, he takes credit for that,
That's right.
and his prices go up.
Oh, absolutely.
I mean, he probably doesn't want to work anyway, but that's,
Even the squirrel finds a nut.
Well, Frey, who's that bald basketball player that got real heavy? He was going to Haney. They did a show about him, and what Haney did was he kept on changing his golf swing, even though he was complaining about when I do it that way, I have problems in my shoulder. So Haney said, because I watched the show, so I changed his whole golf swing.
Yeah.
You watch the show, actually?
Well, no, I was watching Haney. This is like 2 years ago,
Yeah,
and I was actually he had a show, and he had like a lot of stars. I can't remember the guy's
Yeah, but
name.
he was telling you the technique.
Yeah,
how
and
he does
was,
it.
yeah, and how he was changing. He says he's not rotating, so he puts his he
Now,
was.
What the reasoning that he missed was he didn't ask the question, why is he not rotating?
But he doesn't know that.
He doesn't know how to ask that
Of course,
question?
'cause he's not a doctor.
I don't know.
I mean,
Hey, Doc, when I was coaching football,
they don't know.
I was a defensive coordinator, and my DBs had to shift their weight in order to keep up with the receivers. Okay, so you have to sort of visualize a pendulum.
Yeah.
And what happens is when you're banged up in the season, what we were teaching them is how to tolerate the pain and still make some kind of mobility to keep up with the offensive player.
Yeah, well, that's unethical.
Well, it isn't that it's unethical.
Yes, it is.
Well, no, it isn't, because that's the way the league operates.
I know it's unethical.
For them to do that.
No, the way
you never
football,
put anybody in the position of getting hurt. If
No,
they're
no.
if
You're
they're
missing
already
the point.
hurt.
No,
I got
it's not
that.
about hurting them.
I got the point.
Everybody plays hurt in football. There
No.
is not one player that doesn't play hurt.
That's unethical. You should not do that.
I understand that, but the game, the way it's played, is
I
under
know.
pain.
That's why we're on the radio. We're
Your
trying to
fingers
teach.
hurt, your hands hurt. I'm not saying that we shouldn't change it. I'm just saying the way the game is played right now.
That's why we're on the radio, Freddie.
That's right.
We're trying to change that.
But the bottom line is that they teach you how to play in pain. That's
Yeah.
what it comes down
Well,
to. Even my son in college played in
Not-
pain.
Yeah, it's not a good idea, and you don't have to do it. That's the main thing.
Well, that show. Do you remember that? Let's see how good everybody is. Yours. You remember that movie North Dallas 40?
Sure.
North Dallas 40 show. It was a movie, and the guy would get shots in his knee. What was it? Cortisone. Shots in the knee. Shots in
He
the
took
back.
every pill in the world.
Yeah, and gave him a whole bunch of narcotics just to get him on the field. That's unethical.
But forget about the movie. That's a true story
That is
right
a
now.
true
If you look
story.
at the Chicago Bear quarterback is coming out. It was easy to get drugs back in the day. He wrote a book.
Yeah. Yeah.
There isn't anything that you couldn't get.
Oh yeah. Hey, take this.
Who was that?
I don't know.
The Chicago Bear quarterback. What's his name?
Oh God.
The guy with the ball-headed guy now, and he's part of the lawsuit. They want him to join for the concussion lawsuit.
I know who you mean. He had this. He just used to wear the sunglasses.
Yeah.
Oh, by the way, the concussion deal. You can always test for brain function. And the way the lawsuit is going, they don't have to do anything. Just say they have a concussion.
Really?
But you could test for cognitive function, it's called. How do you calculate your memory and all that? If you don't have any loss of that, where is your lawsuit? I mean, what is it? Well, you can still have headache, though. And when your head gets injured, what takes the brunt of the force? It's not the skull. It doesn't change. But what does change is the neck. So most of these people have headache, and a lot of it's migraine because that's the first joint up, first joint on top, and that's where a lot of the injuries are. So they're going to get paid, I don't know, almost $1 billion is going out.
They're going to settle, yeah.
And it does that all the time. Just think about the breast implants. There is an inert substance that is blamed for everything on earth, and
Right.
people got paid for this. I mean, the law system is just bizarre. They're not after truth. They're after big payments.
Yeah, big money.
Well, let me ask you a question. If the lawsuit comes forward, right, and all these guys are ex-football players, and they've been playing for 17, 15, 10 years, everything hurts them. Concussions, headaches, and everything else.
Yeah,
all
sure.
injury in the body, correct?
Right.
So, Dr. Pannozzo, they come in to see you. can you help an ex-NFLer?
Absolutely, sure. They're like everybody else.
Well, you did help one.
They're just larger.
Well, yeah. By the way, I mentioned his name without getting in trouble. The gentleman that offered you a Ferrari to give him 1 more year. I spoke to him. He was an NX. I don't want to give his name out because it's unethical.
The Miami football player?
He was a professional football player that came in to see Dr. Pannozzo with 2 people holding him up.
Yeah, and this is a guy that had he worked 1 year longer. 1 year longer, $11 million.
Yeah,
he lost by not.
That's amazing.
Had he come in and see me, he would have worked for 5 more years easily.
And I spoke to him on the phone, and he said, "Yep."
Yeah, that's true.
He said, I came in with 2 big guys holding me up. No, I wasn't there, but he told me, so I believe him.
Do you have his number?
No.
We got to find this guy. Because think about it. The lawsuit was settled on the concussion deal, right?
Yeah.
You bring these NFLers, and they come in one by one like an M&M, and you work on them. Now, I'm not saying they're going to cure them 100%, but I bet you'll take away 80, 90% of the pain.
Easily, yeah.
Well, he's walking around now. He told me he was walking around. He doesn't use crutches, doesn't use a wheelchair, and he's working, lost weight, and he feels great.
Amazing.
He said he's been to almost every.
Well, he was scheduled for a surgery.
Yeah, he was telling me that. Yes.
The day later, next day.
Right.
He canceled it.
He came and see him.
When I took care of, he canceled it. It took 4 shots, but he stood up and he said, "I can't believe you're a human. Are you from Mars?" He said, "How did you do that?"
And I'm going to answer that question how he does it. Diagnosing the cause.
There you go. Diagnosing the cause.
Well, he's also very good at finding it.
Well, yeah, I've never seen anyone be able to find the pain like that.
But this is the deal.
Well,
Dr. Pannozzo is different.
Machine.
No, I understand, but he's different the way he looks at it.
Yeah.
If you want to know how I think, you can buy my book. It covers everything that you could possibly think of: neck, shoulder, lower back, knee, hip. Philosophy is in there. It tells you when to leave, who you're getting treated for. I mean, I have a sign on my wall in my office in the waiting room that says explicitly, and I signed it. It says, if you're not substantially improved in 2 weeks, you're in the wrong office, which means go somewhere else because you're not happy, and
Well,
I can't help you.
The problem is, I haven't seen anyone.
I haven't seen that either.
But
They didn't walk out.
people get treated for a year with a chiropractor. And I said, why did you do that? Aren't you smart? 2 days is all you give anybody. 2 days, 3 days, that's it.
Dr. Stephen Varick, MD, on a show that was put on a couple of weeks ago that Penn and Teller do called BS. And he said people convinced themselves that the chiropractor worked. He said he doesn't, and he doesn't know anyone that was actually cured by a chiropractor or didn't get pain somewhere else from being manipulated. He said the body's not supposed to be manipulated.
It cannot be manipulated.
Yep, that's what he said.
You can't cure anything by overstretching it, which is what they're doing. All that crack you hear, that's an overstretch of ligament structure.
That shouldn't be done.
Those are injuries.
Yeah.
You don't want to do that.
So this is not only me talking about it, this is a noted doctor, and I can give his name because if you don't believe me, if you have any kind of TV, you got Showtime, go to Penn and Teller. They do a show taking the myths out. Magnets don't work?
No.
I saw the commercial on the magnets, by the way.
It doesn't work?
Copper or something?
The copper.
The copper on the knee. Have you seen that?
Tommy Copper.
Tommy Copper.
And hands. Gloves.
And they have a beautiful young girl swinging the club, and she has a beautiful swing.
Yeah.
And she says it's because of the copper on her knee.
Yeah.
Well, of course, she got an endorsement.
She got an endorsement.
Yeah, they're talking about compression or copper. How does copper do you any good? How does it get in your bloodstream?
I have
You've
no
got to
idea.
be able to test
Electric
for
field.
it. You see, cause and effect that I think about says if copper is doing you any good, you first you'd have to show it in the bloodstream. Then your body absorbs it. The muscles will absorb it, but it doesn't. Copper's not needed. Potassium and sodium is needed for muscles, not copper.
Right.
So, and it's all in the book. Read it, the physiology book. Go to the library or go online, whatever you want. Everything we talk about is true.
That's
so
exactly
muscles
correct.
are affected by potassium and sodium. Potassium in, sodium out, or sodium in, potassium out. There's calcium also involved, but not copper.
There's a couple of myths I want to get out of the box right now.
Go ahead.
Diabetic goes to see you, and you do your thing. I mean, I'm a diabetic, and I didn't see anything fall off, correct? You don't worsen the diabetic's condition.
No.
You don't interfere with the medication.
No.
If I go in there and you have to work on my spine, I walk out. I mean, Jimmy, he's not paralyzed. You don't get paralyzed.
No, you cannot get paralyzed.
It's impossible.
And the injections that you give us are harmless. Do they pinch? Yes. Are they in excruciating pain? No. I never had that kind of pain. I don't know what that means.
We don't like to numb people because think about this. If you're a patient, you want to know if I got the right spot.
Right.
How do you know I got the right spot
That's
if
important.
I numb it?
That was going to be my next
You
point.
don't know. And I've had these shots myself.
Oh, yes, I was
and
there.
This is the technique that I use for me and everybody else. You have to know that the shot went psychologically for you. You got to know it went to the right spot, and you'll know that because it's like a starburst for about a second, and you know that's the spot. Yes, sir, doc, that's it. And then you're going to get the result we want because it's in the right spot. So we don't like to numb anything. Now the diabetics get the blood sugar rise, but it's 12 hours later.
Right.
And it lasts for about 12 hours, and that's it. So for one day, you can handle it. Don't eat the bread. Don't eat, whatever. Don't have coffee with sugar in it. That kind of stuff. You can handle that. And it doesn't go up that high. Even if it does, it comes right down. There's not enough time to make any damage whatsoever.
And there's no lingering effect afterwards that would any side effects?
None. No. It's out of the body through your kidneys in about 9 hours.
Doesn't damage the kidneys?
No.
And the other question I had was the part that you're not numbing so that people say, of course, he's going to put Novocaine in there and it's going to numb it and I'm going to feel better. That's not what we're doing here.
No. Well, of course we need to do that. We need to know we got the right spot. Don't forget, this is an office. We got to get you treated and get you out.
Right.
Because somebody else wants to get treated too. So we have to know that the painkiller, if it goes in the right spot, will tell you pain's leaving. That doesn't mean that the steroid has taken effect yet. It won't.
Right.
But at least you'll know it's in the right spot. And we've had people that walk out of the office and call me the next day and said, I played 18 holes of golf today. Yesterday I couldn't play at all. That's a cure. What else do you want? That's it.
Oh, and I seen you have people wait like 20 minutes.
Yeah, if they think that we didn't get to the right area,
Right.
we just have them wait a little bit longer. And then and I say, if we got the right area and you're happy, then you can leave. Otherwise, we'll take a look at you again. And most people just leave.
Well, it's funny. A lot of people might say, I have to wait 30 or 40 minutes. Let me tell you one thing. I have never gone to a doctor that I hadn't waited an hour for, and they didn't do anything for me but take stuff down, like gastroenterologists or guys like, you waited an hour.
Yeah, in my office, these are all procedures that we do. I mean, they're huge procedures. I've just whittled the time down because I've done so much of it. But you got to take a decent history. You got to take a good examination. You need a weight-bearing film. You need to see it the area on the C-arm. You got to arrange the thing. This is huge stuff that ordinarily you'd go to the hospital for. Mm-hmm. And we do it right there in the office. Why? We know how to do it.
And the beauty of what you do,
and it's safe too, very safe,
which I respect. And this is something that to me is amazing. Freddie and everyone out there listening, you're the person that they see. You're the person that does the X-ray. You're the person that does the diagnosis. So by talking to them and feeling around what's their problem.
Yeah,
that's amazing.
We have to build a trust with the patient. They have to know what they're hearing is correct. They have to be able to ask questions. It's not like sending you out for 2 weeks of therapy and you fail with that, and now we got a bigger pain to deal with. No, you're dealing with the guy who takes your pain out. Any questions you want to ask, I'm going to offer you treatment for it, and I'm going to tell you what it's going to do. If you say no, that's okay. Go somewhere else.
Yeah.
You want the thing treated, we will do it right then and there. That's why sometimes you have to wait. But, when I ask people, I'm sorry about the wait, they said, look, Doc, it's worth it, no matter how long it takes.
Well, Jimmy drove an hour and a half. Jimmy, what'd you say?
Listen, I got a quick question for you. I got a friend of mine that was asking me about this yesterday, and I forgot to ask you. Does it mess with your MS if you have MS at all?
No, it improves it, actually.
Wow.
Good question, Jimmy.
I have a cousin. That's why she was a little skeptical about it. And I said, listen, I'll ask the question. And
what is she skeptical about? There's nothing to be skeptical about. If
she's afraid it's going to make MS worse.
No. If we don't know what makes MS worse. That's one of those diseases that... But if she has a pain, we can certainly take the pain away.
You can take the pain because you did that for me.
Yeah, that's right. That's the same process with them. MS by itself should not cause a pain.
Jimmy, we have a lady in Pennsylvania whose husband decided to take a boot. And I can guarantee you one thing, he's in a lot of pain today. And he's listening today. He's in a lot of pain. He did not opt to come to see Dr. Pannozzo.
He's listening?
Yeah, he's listening. He's watching. They watch every show.
Should not be listening or watching. He should be on a plane.
Well, he's coming down in December. He's going to come see you. But he can't even walk.
He should know that at my age, I don't even know if I'm going to be around in December. So if he
No, then we'll really be up to
the creek. If he needs to take care of, you better come now.
You better call her, Linda.
I'm not kidding.
Hey, Doc, you and I are not young anymore. The only reason we do this is try to help people. I mean, I've seen you, it's amazing. I mean, I wish someone could just come in the office, don't even make an appointment, sit and watch the people when they come out of the office.
They could just buy the book.
They could go. Where they go, Freddie? Get that book?
Amazon.com.
Amazon.com.
It's under my name or
right. And you go to PayPal and get
or
it all
Pannozzo.tv. You can order it there too. Anything you want to get for the doctor. Pannozzo.tv.
So you can read about the philosophy, and but what we're talking about is all true.
Yes, it is.
Everything we say has been true. And just you got to believe it.
What was that, Jimmy?
You don't. I don't know what to tell you.
I did do what you said. I went there and I sat in there. I was there for 45 minutes just listening to everybody.
Coming out.
and I came out feeling a different person. So
the amazing thing is that Jimmy drove an hour and a half to get healed.
I would drive 2 days to get healed from pain.
And he's been doing this since '95. How do you live with that pain, Jimmy? What you take? A lot of medication?
I'm hoping I don't live with it now.
You won't?
No, but before.
I did. And what I think, Doc, I told you I was doing a leave or something. You said, what are you doing that for? You said aspirin. Okay, well, I don't need that now, right?
Yeah, leaf causes kidney damage and liver damage. And so you want to stick to aspirin. Aspirin's your best drug. I've been saying that for years and years. And occasionally you'll see somebody will say that. But Tylenol was sold by television.
That's right.
A lot of it.
Period.
I brought the worst case to Dr. Pannozzo. A guy was in a motorcycle accident. He had rods. That foot was coming off. They had scheduled him to remove the foot. And that guy is walking around today because of you. And he stopped me at the bank. He said, look at me. He lost a lot of weight, changed his whole life. That was the bodybuilder.
Yeah, why is that? I would tell you why. The techniques we use are not taught in residencies for surgeons. They're taught how to do surgery without infection. And they do a good job at that. And if you need a surgery, they're well able to do it. But what if you don't? And you get operated. Now you got a problem in addition to the first one. So you got to be careful. The musculoskeletal treatment that we do is not taught to anybody. In neurology, they don't teach that. Chiropractic, they don't teach that. The physical therapy, they don't teach that. Acupuncture, they don't teach that.
Oh, acupuncture.
I mean, people have acupuncture, and I said, what is the doctor treating? They don't know. I said, well, how does he know what treatments to do? It's the same thing on everybody. I said, pinch yourself at home. I mean, this actually happens. I said, pinch yourself at home, and then you got a treatment because you know as much as they do.
So, in other words, reflexology, if I stick in my toe, I'll be okay?
Well, yeah, they're not taught diagnosis.
No, of course not.
They're taught technique of placing needles for a yin and yang, which is made up by these old Chinese. I don't know how they...
It's Harry Ying and Bobby Yang.
What are these twins? Anyway, there's no truth to that. I studied that, so I can talk like an expert. And let's see, what else? So we're trained in the
cause and effect.
Cause and effect. We're thinking properly. Now, a lot of physical medicine, of which I was trained, residencies don't treat that. They treat other things. Mm-hmm. Like how to take care of chronic pain with shots and so forth. But unless you understand why the pain is there in the first place, you can't get the results that we get. And I'm telling you, we get the results. Just about 100% now. Now, we went from 50% gradually over the years to right now I can tell you I get 100% cure rate on what we're after.
Right.
Not all of it, just the one we're after.
That's amazing.
Right? Well, it is amazing. That's the bottom line.
Well, folks, again, I couldn't take any of your questions that you sent in. I'll be away on next week, and my good buddy, Freddie Santori, will be here to help the doctor. Thank you so much for tuning in, and we'll see you again.
Thanks a lot.
Phone numbers.
561-381-5800 to talk to the doc. 561-381-5800. And, Jimmy, thank you for everything, my man.
Have a good day.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Pannozzo will consult with you to determine the